Hello, my name is Dan Tsarenko. I am a respiratory therapist who is part of your healthcare team. How are you doing today? Great. I'm doing great. Thanks for asking. It's really nice that we can meet virtually like this and talk about your care plan that we'll be creating today. And so that's really awesome. Today, I'd like I said, to talk about your care plan and about managing your COPD. And our goal for this meeting is to really help you better understand your condition and what steps that we can take together to help manage it and how you can feel more confident and really in control of your breathing. Does that sound good? Great. Has anyone ever talked to you about what COPD actually is? Perfect. COPD is a long-term lung disease, and where a part of it makes it really hard to breathe. You can breathe in very easily, but breathing out can be very difficult. It's an umbrella term, really, that includes two other conditions under it. The first is chronic bronchitis, which is an inflammation of your airways. This causes you to have a lot of mucus buildup, right? Because when we have that inflamed airways, our body's natural response is to secrete a lot more mucus secretions. But all of that will trigger you to cough more. Your body's trying to get that out. And all that mucus blocks and obstructs your airways, making it harder to breathe. Because when we take a breath in, our airways kind of expand a little bit, allowing more air to kind of pass through those secretions. But when we breathe out, our airways tend to close back up, and if there's something blocking it, it makes it very difficult to get that air out. The second element or condition that is associated with COPD is emphysema. And emphysema is a condition that affects really the air sacs of your lungs or your alveoli. It makes them weaker, they tend to collapse more easily, and over time, these two conditions, as they grow, develop, and become progressively worse, your airways become more narrow, you have more damage in your lungs, and it makes it harder to move air in and out of your lungs. That's why you're experiencing symptoms like shortness of breath, right? When we just can't really catch our breath, we might feel that tightness in the chest. Wheezing is because our airways are shorter and are smaller in a sense, and as air is passing through it, it's creating that noise. You have that chronic cough because of all that mucus that is in there, and then of course increased production of mucus. And so COPD is a condition that doesn't go away, but with the right care plan and ways of treating it, we can definitely help reduce that symptom burden, slow its progression, and improve your quality of life. So now that we've covered a COPD and exactly what it is, let's talk about ways in managing it. Right, our main goals for your care plan today that I wanted to go over with you are, the first one is to relieve symptoms like breathlessness or coughing through your medication management. And so we wanted to look through the medications you're currently on and see if there's any ways that we can improve them. Going through your action plan, we'll talk about what that is and how to use it when you're experiencing flare-ups or even during your daily life. And then the other part of the plan is to reduce the number of flare-ups and hospital visits in general through lifestyle and lifestyle modifications and changes that we can make. So does that sound good? Perfect. So the first thing I wanted to go over was your medications. In order to relieve your symptoms the best that we can and keep them under control, help you breathe easier, maintain that cough, or get rid of that cough, the best ways are to take your inhaled medications or your inhaler. I saw on your chart that you're currently taking albuterol when you feel short of breath, and then you take your fluticasone and your Spiriva. Is that correct? Yes. Now that's quite a bit of medications that you've had. Do you find it challenging to take all of those meds every single day? Well, this is one of the things that I wanted to address in your care plan today was updating your medication list. Now, I really like that you have that albuterol as a rescue inhaler and use it when you feel short of breath. I think that's great. It's a great bronchodilator, really helps open up those lungs and those airways so that you don't feel short of breath. So I don't want to change that. We'll leave that as it is. But I think that we can simplify your medications by replacing all of those other ones, or the two other ones, with one inhaled medication called Trelegy. Now, the Trelegy is a combination of three different medications all into one inhaler, and you only have to use that once a day. It makes it really easy to take. You don't have to remember all of these different, days and times when to take them, when to go, with the meals. It makes it a lot easier to take all that medication and make sure that you're getting it. Does that sound like something that you would want to do? Perfect. A question for you. Do you use a spacer with your albuterol? Spacers definitely help get more of that medication down into your lungs and increase the effectiveness of that medication. And so we'll definitely get you one. We'll show you how to use it, the proper techniques on how to use your inhalers in general, and we'll go over more of that with you. But I wanted to make sure that that was on your radar. And I find a lot of people don't know about spacers, and I wanted to make sure that that was a part of your care plan, that you knew exactly how to use it with your inhalers. Another really important piece of your care plan is something called the COPD action plan. Now, this is like your personal roadmap for you and reminders for you. So it helps you notice changes in your breathing and in your symptoms. We'll give you, when you're going to get ready for discharge, a little kind of magnet sheet that you can put on your refrigerator that really has this laid out. But I just wanted to go over some of these zones with you real quick. So there are three easy zones to follow. There's a green, there's a yellow, and then there's a red. So the green zone, which will have a checklist on that sheet that I talked about, is your normal breathing, right? You're able to do your usual activities, your symptoms are stable. When you're in this zone, you can continue to take your regular medications, follow your daily routine. It looks like you're doing great. If you start noticing changes, like you may be coughing more, producing more mucus, or feeling a bit more short of breath or out of breath than usual, you may be creeping into the yellow zone. Now, in this yellow zone is where you should probably take these extra steps, right? Using your inhaler, your rescue inhaler, more often than you normally do. Maybe check your oxygen if you're on it at home, and potentially even call your healthcare team or your primary doctor and just to ask for some advice. Like, hey, I'm noticing this and this. Is there anything else that I can do? Because when we intervene at this yellow zone, studies show that it really does help bounce us back quicker into that green zone without dropping us down into the red zone. The red zone is, of course, when your breathing gets much worse. You can't catch your breath, even when you're just sitting and you're at rest. Your fingers and your lips maybe begin to turn blue, the tips of your fingers, or you start feeling a little bit more confused than normal. This is, of course, an emergency, and you should begin to take your rescue inhaler often, very often, like within minutes of each other, and call 911 and get to a hospital right away, because that's it's showing signs of an exacerbation, and we want to stay on top of that. So following this action plan can really help catch those problems early, as you saw, and prevent them before they turn into something very serious. And so I'll make sure that before you discharge here, that you have that you understand that, your family understands this plan, and know exactly what to do in each one of these steps. So, of course, our goal is to make sure that you feel confident in managing your COPD, and you're never left wondering, like, hey, I'm experiencing these symptoms. What do I do now? Sound good? Perfect. I saw in your chart, too, that you have been having lower levels of oxygen, and they've, of course, while you're here in the hospital, they put you on oxygen, and our plan is potentially for you to go home on oxygen. How do you feel about that? I know it seems like it can be a leash, right? Or you may feel tied down having all this oxygen tubing on you, but there are many ways, especially with portable models or anything, stuff like that, where you can still go out to the store, enjoy a really nice walk too. In fact, a lot of people are surprised by how much better they feel once they really do start using oxygen at home. It gives them more energy, helps them sleep better at night, and it makes everyday tasks that used to be very challenging for them feel a lot easier to accomplish and complete. It's it's not about limiting your life and putting on this oxygen or going home with it. I don't want that to be a limiting factor for you, but it's about really helping you live your life more fully and making you feel really more confident in your daily activities. And so before you discharge here, we'll make sure to walk through exactly how to use oxygen, how it works, how to use it safely at home, and how to take care of that equipment and make sure that you're set up on that. So I wanted to make sure that was part of your care plan as well. And if you have any concerns about all of that, we'll make sure you know who to call and get all of those questions addressed before you leave. Another element of your care plan that I wanted to include and talk with you today is pulmonary rehab and adding that. Have you ever heard of pulmonary rehab? Pulmonary rehab is a special program that is designed for people with chronic lung conditions like COPD. It brings together different healthcare professionals, and they teach you breathing exercises. They give you more education. They go through physical training with you. All of that, of course, is aimed at making you feel better and live more confidently with COPD. That breathing exercise that I talked to you about, they'll teach you here how to cope when you feel short of breath. Because like I said, COPD, very easy to get air in, very hard to get air out. And so they'll teach you what are the best ways to do that. Pursed lips breathing, kind of tripoding in a sense, and helping really get all of that air out, and ways to manage and control your breathing so that you don't panic and get yourself kind of wind up. The education element in there also will just be another point of contact, because you're meeting with them regularly throughout the week. If you're noticing signs of a flare-up or you have questions about your medication, they are there to provide that for you. And of course, that physical training. Now, it's a gentle and safe physical training, and it's always done under supervision. So it's really there to help you build strength and stamina, so you can go and do things that you enjoy, whether that be walking, playing with your grandkids, or anything else. You can do all of those things without feeling tired, and have a way to train yourself up for that under supervision, of course. And studies have shown that people who go through pulmonary rehab and complete pulmonary rehab have way fewer hospital visits, have a better quality of life, and just feel more confident in their management of their symptoms and their disease. So it's definitely not a one-size-fits-all type of a program. It's specifically tailored to you, and we'll walk through it with you to create a program and a plan that fits you. So does that sound like something you'd be open to trying? Great. I will definitely add you to the list for pulmonary rehab. And one of the other things that I wanted to talk with you was lifestyle changes. It's a huge part in managing COPD, and I see in your chart that you are currently using tobacco. What can you tell me about your tobacco use? I see that you are currently smoking. I wanted to advise that quitting smoking is the single most important thing that you can do to better your health. And we can offer you a lot of tools, support groups, even medications such as patches, gums, lozenges, things like that to really help you succeed. Now, some people say, "Oh, I've been smoking for so long, so what's the point in quitting now? 40, 50 years of being smoking. There's no point, right?" Well, studies have actually shown that our body really starts to heal almost immediately after we stop. After just 1 hour of quitting and deciding to make that decision, your heart rate and blood pressure begin to return to normal. After 12 hours, the carbon monoxide levels in your blood drop back to normal, allowing more oxygen to reach your organs and making you feel a little bit more better. After even a week, your circulation starts to improve, your lung function begins to increase, and you might notice that you can walk a little bit further without feeling tired like you used to. After about a few months, coughing or shortness of breath, that kind of feeling, begin to decrease to a point where you're noticing it. You're like, "Oh, I'm not coughing as much, I'm not getting short of breath as often." And after even a year, your risk of heart disease is cut in half compared to somebody who continues to keep smoking. And so quitting is definitely not an easy thing to accomplish. And it's not about erasing everything that you've done in your past, but it's about giving your lungs and your body the best possible chance at a better future, right? And so you won't have to do it alone. Like I said, we have different support groups and medications that we can help give you to wean you down from those, the nicotine levels and things, and we can really create a plan for you there. And so that's all that I wanted to cover with you today, and helping set up this plan of care that we will continue. Of course, we will go through all of this more in depth, provide specific education at each one of these points. But this is just a nice overview to really understand the steps and the major topics that we're going to be hitting. And so I know living with COPD may seem challenging, but you're definitely not alone. With the right plan that we have set up for you now, support from your family, even changing these daily habits, you can still do a lot of the things that you love. So thank you for taking the time to talk with me today. I look forward to helping you breathe more easily and setting you up to live better and managing your COPD. So you have a great rest of your day.